Hi everyone, it's Stephanie here. Today is Friday, June 17th, and I'm just checking in with everyone to let you know about my third clinic visit. If this is your first time watching, my insurance requires that you have 4 visits before you start the approval process for the weight loss surgery. I was trying to decide whether or not I was going to go between the vertical sleeve or the Roux-en-Y, and I decided on the Roux-en-Y. I wrote to I think it might be Thinner Times Forum, and just kind of got some feedback about that, and someone suggested that I should go towards the Roux-en-Y because it would resolve my other problems faster. I have the obstructive sleep apnea and the high cholesterol, high blood pressure, and I have degenerative joint disease. So after I heard that, I thought, well, maybe that's the best thing for me. And plus, since I have this sweet tooth, I thought maybe I need that dumping consequence, and that will help me keep my sugar intake under control. So Monday I went to one of the support groups that they have at the hospital, and it went okay. People were very enthusiastic to help, and there were some people that were more enthusiastic than others. So when, as pre-ops started sharing, there were people who were very eager to jump in and give us their wisdom, and which that's all really great, but most of the time we didn't even have a chance to kind of finish even our sentence before somebody was jumping in and with their encouragement. So I did speak with the nurse about that, and she said that she was going to be, there was someone running it that doesn't normally run it, and so the nurse said she was going to make sure that some guidelines were put in place so that jumping in doesn't happen all the time. So anyway, today was my third appointment, and I went in, I think at 2:33 today. I was 2:40 in the first appointment, 2:33 the second appointment, and then today I was I think 2:29. So I think that means, I think that was about 4 pounds down. So after I spoke with the dietitian, we thought, well, my goals moving forward would be to increase the exercise, and then to practice not drinking liquids while I'm eating, because she was saying that's very important not to drink liquids at the same time that I'm eating. So I've had my psych evaluation, and that went very well. I've already been seeing that particular doctor being treated for depression for the last 10 years. So we kind of just spent the hour getting to know each other once again, and so that went very well. And she said that she would gladly recommend the surgery for me. I had an EGD and a sleep study within the last 1.5 years, so I don't need to do that again. And so I'm pretty much done with all that sort of thing. So I was kind of curious as to how long it takes for the approval process once that last appointment is done. I asked the nurse, how long does it take, and how does it work with the paperwork and everything? And she looked at me, she said, there's no paperwork. There's no approval process. We're the ones that designed this program to meet the needs of the insurance company, because I work at a hospital, and I have their insurance, and so the bariatric clinic is in the hospital. It's their doctor, and so they wrote the program to satisfy the requirements of the insurance, and so there's no paperwork, there's no waiting period for the approval. As a matter of fact, she said, well, if you want, we can schedule the surgery today. And so that was pretty exciting. So by the time I left there, I had, not only did I have my 4th appointment scheduled, I have my pre-op class scheduled, and I have my surgery date, which is August 1st. It's kind of interesting. It's August 1st. I would anticipate going back to work at about 3 to 4 weeks, and if it goes that way without any complications, then I would be back to work on my birthday. So everything's gone a lot faster than I thought, and I'm really excited. One of the things that I struggle with is staying in the moment, and just like I said, I'm already talking about going back to work, and so I'm just trying to stay in the moment, and like what they say, taking it one day at a time. I've been very anxious at work. We are going through some layoffs, even though the economy is getting better. People are being laid off at every level. So I've been anxious about that, and I've noticed that how that affects my eating and my food choices when I get anxious. Because usually at home I'm relaxed, even in the evenings, or even on the weekends I can eat really normal. But when I'm at work, things are more stressful, and so I'm looking for chocolate or burgers and fries and things like that. So, but some of that anxiousness has gone away. Where we were told, in my department anyway, that we were going to stay intact. There weren't going to be any layoffs, and so I can move forward. Because I was, already thinking, well, if I do get laid off, I'm determined to have the surgery. What am I going to do? And I had all these contingency plans in place, and so and talking about thinking about Cobra and things like that. But I don't have to worry about that right now. So I'm very happy about that. So my next appointment, I'll be spending more time with the nutritionist, just talking more about the eating plan that happens after surgery. And the pre-op class is also more time with the nutritionist. And then there's time with a physical therapist as well, talking about exercise, I suppose. So in the meantime, my daughter and I, we've been experimenting with the protein drinks. I've been watching everybody on YouTube talk about the things that they like. And I've always been a fan of protein drinks. So I already had some protein powder here, but I have bought some more. Went to GNC and bought some Total Lean, and we also bought some soy protein. And so we've tried some smoothies, and they're pretty good. Some of them taste like chocolate shakes, and we put peanut butter in them, and they're very tasty. So, but I'll talk about that more in a different video. So I'm going to be signing off for now. I just want to thank everybody who subscribed to my channel. I'm really excited about that. I figured nobody would even be interested in my channel, but I really appreciate the people who have subscribed, and I appreciate the comments and the encouragement that you've given me. I don't know, I expected everybody that's gone through weight loss surgery to have heard something about this community on YouTube, and every time I brought it up, they were like, oh no, I never heard of that. So I've been talking to everybody about it, and really encouraging everyone to get on YouTube and look at the videos, because I think that they're very encouraging, and the people that don't know about it are missing out. So thanks everybody, and I will keep you updated about things, and I will see you next time.